So prostate, first we need to know what is prostate and where it is. So prostate is an organ which is present only in the men. Prostate is right below the bladder and it will be engulfing the urethra all around. So it is present around the urethra. So when it enlarges in size, so this prostate slowly starts blocking that urethra. The passage which carries urine, it starts blocking it.
So what is the minimum age, sir, like you have seen as per your experience?
So the lowest age for whom I have seen prostate enlargement is around 38. So first, if we see how to detect whether there is prostate enlargement is significant, and if there are symptoms and if these symptoms are neglected over a period of time, then definitely the kidneys can get affected.
So talking about the urinary symptoms, people think like it's very embarrassing.
Yeah.
And it's not that important to talk about it. Hello and welcome back to another episode of the Healing Arts with Surya. Due to some technical audio issue, we are recording this introduction part separately to ensure you have a very good listening experience. So today's topic will be on the prostate enlargement. Did you know that many men over 50 they wake up multiple times at night to urinate? They think it's just because of an age, but the symptoms like multiple urination, difficulty in passing the urine, or feeling like the bladder is not yet empty, that might be early sign towards the prostate enlargement. To help us understand this better, today we have with us Dr. P. Bhanuteja Reddy, who is a senior consultant urologist at Apollo Hospital, having more than 11 plus years of experience into the laparoscopic endourology surgeries, RIRS, kidney stone, kidney transplant, and also the advanced robotic urological surgeries, who has performed more than 3,000 plus surgery and is known for his expertise into the minimal invasive surgeries and the techniques towards his patient for the fastest recovery and better outcomes. So, welcome to the show.
Thank you. Thank you, Surya.
Thank you for your time, sir. So, before we go further into or deep dive into the topic, first we would like to understand, sir, what is the prostate enlargement?
Okay. So prostate enlargement, see, in men who are above 50, usually prostate starts slowly growing. So prostate, first we need to know what is prostate and where it is. So prostate is an organ which is present only in the men. So in men, it is located just below the bladder. So bladder, urinary bladder is the area where the urine comes from the kidneys and gets stored. So once it gets stored, it goes through a passage called urethra. So this prostate is right below the bladder and it will be engulfing the urethra all around. So it is present around the urethra. So when it enlarges in size, so this prostate slowly starts blocking that urethra. The passage which carries urine, it starts blocking it. So it is most commonly seen in men above 50 years of age. But nowadays, in about 10% of young males, also we are seeing it quite early for it to start getting enlarged. So usually it is seen above 50 years. One other important cause for it to enlarge is the testosterone hormone in men. So those who have higher levels of testosterone, they tend to have prostate enlargement quite earlier in their age.
So what does that mean, sir, the testosterone? What the term is?
So the testosterone is a hormone. It's a male hormone. So which gives us strength, which gives us muscle power. So which is very important for our secondary sexual characters to develop, like the body hair, facial hair. Okay. So it's a very important hormone for men. So because of this hormone, so it also plays an important role for prostatic enlargement. So age along with testosterone hormone, these are the two factors which play a key role in prostatic enlargement.
So you can say the hormone. Age is not factor.
Age is also a factor,
okay,
as well as the hormone. So both of these are the factors.
Okay, but sometime before 50 also you said no.
Yes, so we are seeing in younger age groups also, so that can be attributed most likely with the hormone. So for them, the hormone levels might be significantly higher. Persistent peaks of testosterone hormone levels can cause the prostate to enlarge little earlier in their life. So 50 years is an average age decided after conducting many of the research studies that most of the men above 50 start developing. Most of the men start developing symptoms because of prostate enlargement.
Okay.
Few of the men might have it earlier as well, but they don't have symptoms. So 50 is the cutoff mark which has been decided based on many studies which are conducted on the population, and then that's when most of the men tend to having the prostate enlargement. And few, not usually all of them above 50 also develop symptoms. So usually 20 to 25% of men only above 50 develop symptoms. They might be having prostate enlargement, but symptoms are seen only in 20 to 25% of the men.
So what is the minimum age, sir, like you have seen as per your experience?
So the lowest age for whom I have seen prostate enlargement is around 38. 38. So 38 is the least.
Okay. And the main things which we have seen, like the symptoms, if we talk about the symptoms, it's very common.
Yes. So coming to the symptoms, if you see, so usually there are two kinds of symptoms which we notice in any kind of urine pattern. So we divide them as obstructive symptoms and storage symptoms. So the symptoms, obstructive symptoms are like most commonly weak urine stream. When the urine stream reduces in the flow. So that is one thing. When a man is trying to strain to empty his bladder, to pass urine. So that is one obstructive urinary symptom. Other one is dribbling of urine. Sometimes few of the men will have that passing of some drops of urine.
Right.
So that is dribbling of urine. And feeling of incomplete emptying. Even after going for the urination or washroom, they still feel their bladder is still filled with urine. They still feel they have not emptied it completely. So these are all come to the category of obstructive urinary symptoms.
So for that
and these most likely indicate prostatic enlargement and obstruction. There are symptoms like storage symptoms, which are mostly related to the bladder.
Okay.
So they are symptoms like frequency, urgency. Urgency is unable to hold it for a longer time. And nocturia. Nocturia means a man passes more than one time in the night, and it usually disturbs his sleep. So when he passes more than one time in the night, and it disturbs his sleep pattern, so that is where we define him as having nocturia. So these are the symptoms which are storage symptoms. And this phenomena of these symptoms, storage symptoms and obstructive symptoms, occur together because it is a dynamic phenomena. The physiology which happens between the bladder and the prostate and the urethral passage is a dynamic phenomena. Because there are sphincters. Water sphincters are like gates. They are like gates controlling the urine flow. Because when they close, we can able to hold the urine. Our bladder starts storing the urine. And then when these gates relax, they relax with the impulses from the brain. So when our brain gets stimulated that it is safe to pass urine, like when we are in a washroom, when we are in a toilet, so that is when these gates relax, these sphincters relax, and the urine comes out. So it is a dynamic phenomena.
Okay.
So
because symptoms like frequent urination, as we see, that's maybe because of sugar. There are many sugar patients. They think like it might be because of sugar, but so it's very difficult to identify whether it's something else or it's due to sugar.
So
when they should consult a doctor.
So most of them will have this. So once as someone is aging, they have a notion that it's because of the age. Some people think who are diabetic that it's because of the diabetes that they are passing more number of times.
Right.
So diabetes, yes, agree. Age also agree. But along with that, prostatic enlargement is one common condition where these symptoms occur. So if a person is having it too frequently, so irrespective of the water intake he takes, even if he is having only a liter or 2 liters of water per day, still he tends to pass it for more number of times. So that's when we need to even check whether there is any prostate involvement in it. So, because if he is passing once in every 30 minutes, 45 minutes, it couldn't be only diabetes. It couldn't be only age. There might be prostate enlargement as well. So, that is very important factor which has to be ruled out. So, if one is having the notion of he is passing more number of times only with diabetes, it might not be so.
Okay. So when they consult a doctor, so how they will find out, sir? I mean, is there any surgical procedure they have to go, or any
So
kind of test?
first, if we see how to detect whether there is prostate enlargement, so one important thing is undergoing regular health checkups. So usually after 50 years, we usually recommend health checks yearly once. So during the regular health checkups, if we find any sign suggesting of prostate enlargement, so that is when they should see a urologist. So urologist is a person who deals and treats with the prostate diseases. So when you see a urologist, first a urologist will examine his prostate. So when we examine, we will know whether it is enlarged or not. So based on that, we will advise some tests. So the common tests to detect prostate enlargement is ultrasound.
Okay.
So in ultrasound abdomen, we can see the prostate size. We can see how the bladder is, whether there are any changes which are caused due to prostate enlargement. And one important factor is we usually measure post-voidal urine residue. So which means after emptying the bladder, if there is any urine which is being left behind.
Okay.
So ideally it should be less than 25 ml. So if it is more than 25-30 ml, so that could be significant. So that is one important test which detects whether there is any prostate enlargement. So one, prostatic examination by a urologist. Second, an ultrasound abdomen to see for the prostate. So these are the common things where we can know whether there is any prostate enlargement.
Is there any connection to the kidney? I mean, does it affect anything? If they delay-
Yes, prostate enlargement in earlier stages doesn't affect the kidneys. But if prostate enlargement is significant and if there are symptoms and if these symptoms are neglected over a period of time, then definitely the kidneys can get affected. Because when it's like a pipe and a motor phenomena. Like if suppose kidneys, for example, are like motor, and if the prostate and the urine passage is like a pipe, the pipe gets blocked with some dust or some mud or something, then the motor will be at a severe strain. So similarly, if prostate is enlarging and blocking the urine passage, so these kidneys are at a severe strain. They tend to get some back pressure changes, and that's when the kidneys function keeps coming down. So kidneys can get affected with their function in the long run over a period of time.
Okay. So when medicine can help and they think like it's not enough, if they comparatively see both the things.
So usually medicines usually help in almost 70 to 80% of the men who are suffering from prostatic enlargement symptoms. So only 20% of them, they might not help. Even usually how we assess is we start them on medications, we ask them to follow up regularly. So we see how the response is, whether their symptoms have reduced. So those who are comfortable with the medicines, we usually continue them for a longer time. But those who are not responding for medicines, their symptoms are still persisting or they are either worsening, then that is when we discuss with them about the surgical options. So the surgical options are also very minimally invasive nowadays. We have got advanced technology procedures like laser, like water vapor therapy, like aqua ablation, like prosthetic implants. These are all the recent advances and the latest techniques available.
So we have heard a lot about the laser. So anything you would like to, talk about the laser things where we should get to know? And
so laser is one of the latest technique which is available in the market now. So the laser is an energy basically where we use this laser to scoop out the prostate or to cut the prostate and then remove it. So it is an endoscopic procedure where with the help of endoscope we go through the urine passage till the prostate under a magnified vision very clearly with the help of laser energy. We cut the prostate and scoop it out like how we scoop out an ice cream. So we scoop it out completely from the capsule. So that is where the prostate lies on, that is like a boundary to it. We scoop it out completely and then remove it out. We just churn it out into pieces and then remove it outside. So there won't be any kinds of cuts, any kinds of stitches. There will be very, very minimal bleeding and there will be very, very minimal side effects with this procedure. So another advantage is, if you compare to the standard TURP procedure which we do and this laser, the chances of prostate regrowth over a period of years will be very less.
Okay.
So that is an added advantage. And another important advantage is it can be comfortably done in patients who are on blood thinners for some heart conditions, who are having more number of comorbidities. So for them, laser is definitely helpful, and it is more so also helpful for larger prostate glands.
Okay.
So the larger prostate glands with the standard TURP, the side effects or complications can be higher. With laser, these complications and side effects are very, very minimal. So laser is also helpful for larger prostate glands, and it is quite safer. So usually, blood loss is very, very minimal. We hardly see any blood loss. Usually, those patients of mine who undergo laser procedure, the second day they get their urine catheter removed and then go back home, and they are back to their regular work life and family life on the second day itself. So it is such modality with a very faster recovery.
Thank you, sir. The frequent urination is normal with age.
No, that is a myth. It is not only because of the age, it can be because of multiple factors. It can be because of prostate enlargement. It can be sometimes because of the medicines. Few of them might be taking some medicines related to heart, which will push out a lot of urine. So it also varies depending on the water intake they take. It depends on the lifestyle. If they are very anxious and stressful, might be the urination episodes might be more. So it is definitely, frequency is because of age is definitely a myth, but not a fact.
Okay. Next question. Surgery is risky.
So surgery is definitely not risky. We have minimally invasive, ultra minimally invasive, advanced technologies like laser now. So it is definitely not risky. I myself have done almost 5 or 6 prostate surgeries for those who are more than 90 years old, and they are 90 years old and they are quite happy now. Okay, so it is definitely not risky.
So prostate enlargement means prostate cancer?
No, prostate enlargement is a benign condition. It is a slow growing condition, whereas prostate cancer is an aggressive condition where the cells multiply quite fast and quite aggressively, and it can spread to multiple areas of the body. So both are different. Both treatment modalities are different.
Okay, sir. So surgery is the only thing that they have to go with?
No, as I told you, so in the initial stages of prostate enlargement, we can treat them with lifestyle changes. We can treat most of them with medications. Almost around 70 to 80% can be comfortably managed with medications alone. Only those who have specific indications, those who fail responding on medical therapy will need surgery.
Okay. So laser treatment is painful and needs a long recovery time?
No, that's definitely a myth. Laser treatment is very, very less painful, and the recovery is quite faster. So usually a day or two, he will be quite normal. He will be back to his all daily routine household activities, work. So laser is the best and the advanced procedure with very, very minimal complications and a faster recovery.
Okay. So only a very old men get prostate enlargement?
No, that's not true. Even younger men we are seeing nowadays, because prostate enlargement is also related to hormone testosterone. So we are seeing even in younger groups between 36, 37 to 45 also. So it's not only related to old age people, even younger men also might get some symptoms because of prostate enlargement.
Right. So talking about urinary symptoms is very embarrassing. Some of the people think, and they think it's not that important.
Yeah, so considering our social environment, definitely most of the people think that sharing the urinary symptoms, sharing their frequent visits to the washroom is especially the ladies or women in our society think so, but that is not so. So when someone neglects these symptoms for a longer time, that's when it becomes a complex problem to treat. So if someone is having these frequent urination episodes, they are getting up in the night, the sleep is getting disturbed, they are feeling burning pain in urination, they are unable to control their urine, there are some drops which are leaking. So these are very quite common symptoms which can be shared, discussed with their doctor, discussed with a urologist. They can be very well treated completely. They can have a happier lifestyle. They can have a healthier lifestyle. They can do their work, meetings, everything very quite comfortably. So I think now it's time to discuss.
Absolutely.
There should be no shying away. They can discuss these symptoms. If not with the family members, they can directly meet a nearby urologist and discuss these symptoms. And they can have a good, comfortable life.
Correct, sir. So any piece of advice lastly you would like to give?
Yeah. So for those men or women who are suffering from these symptoms, so kindly consult your doctor, see a urologist if you are having significant urinary symptoms, get your regular health checkups done, especially after 50 years. So you should get your annual health checkup done every yearly to detect any kind of earlier signs or symptoms which we see. And especially for men who are 50 years, get yourself your prostate cancer screening done. Even prostate cancer, when detected early, can be cured completely without those complex effects of spread of cancer. So get your regular health checkups done. If you are suffering from any of the urinary symptoms which I have discussed, see a urologist immediately and get yourself treated completely. Don't get your urinary symptoms worsen your lifestyle. Have a comfortable lifestyle, have a healthy living, have a safe health. Thank you.
Thank you, sir. Thank you so much for your time.
Thank you.